Hi Frank, my name is Kristen and I'm a physical therapist. From the history you've given me about your injury, it sounds like you are an avid basketball player and in pretty good shape. It also sounds like from your symptoms that you have developed pain high up on the tibia. From the history you've given me, it sounds like you have a high ankle sprain. Bad ankle sprains can take almost longer than fractures to heal at times. You also mentioned that you thought it could be a possible stress fracture, and an X-ray will always be the best thing to rule that out. So if your symptoms don't get significantly better, it would be worth having X-rays. But even a stress fracture should be healed by now, since this injury occurred 3 months ago. So I'm going to address it like it is a high ankle sprain, and then based on your compliance to doing what I tell you today, then you'll be able to rule out whether that's the problem or it could be something else, and then we'll have to look into that further. So your symptoms you described are high up on your left tibia. The left tibia is actually medial. So most people, it sounded like it was on the outside of your knee, so that your pain is here, and that you have most of your pain when you're jumping, playing basketball, and that it's bothered you so much that you've been playing through the pain, although it's affected your vertical jump. So there's a few things I'd like you to do. The first one is we need to control the inflammation. So I always recommend ice and icing 2 to 3 times a day for 15 minutes. If you're that consistent for a few days, then you'll really control the inflammation. Always ice after you've played basketball to control the inflammation. And aside from ice, a few things you can do is, one is you can self-mobilize your fibular head here, which is commonly a factor with regards to the high ankle sprain. So you're going to just grab this bone here and gently move it back and forth. The plane of movement is kind of on a diagonal here. So you'll feel as you put pressure that you can feel just a little bit of movement. You'll also probably feel tenderness through here. So the next thing I'm going to have you do is massage it. You're going to get right in and find those sore spots and just massage the tissue. And as you keep massaging, the pain should become less. So between the massage and then mobilizing the head of the fibula, which is just grabbing on and wiggling, there's not a whole lot of movement. You'll feel just a small amount of movement, but that will free up some of the ligaments and tendons that you may have injured. And then, of course, utilize ice packs. And as the pain decreases, I want you to slowly progress back into your regular exercise regime, which means playing basketball but maybe not jumping as high, and then progress to playing 50%, then play 75%, and then work your way back to 100%. And let pain be your guide. You should be pain-free. I don't believe in playing through pain unless it's a really big event. So I hope that addresses your question, and if you have any further questions, please feel free to contact us. Be well.